Hi, welcome to Suman TV viewers. I am Dr. Chava Anjaneyulu, Senior Consultant ENT Surgeon working with Asian ENT Care Center located in Panjagutta, Hyderabad. Asian ENT Care Center has all the facilities, nasal endoscopy, all endoscopic evaluations in OPD, hearing evaluations, vestibular balance evaluations, speech evaluation, hearing aid evaluation and prescription. All the facilities are available related to the ear, nose, throat problems. Lot of children have the problem of the ear discharge. It will happen in children less than 2 years also, middle age and old age people also. But it is more common in children, especially between 3 to 10 years of age. In that period, children goes to the school, they don't have much immunity, so recurrent viral infections or cold happens. This infection spread to the middle ear through the eustachian tube and cause middle ear infection. This we call it as a otitis media. Once a fluid accumulates in the middle ear, it will rupture the eardrum, that pus will come out. If you neglect the ear discharge in the children, if you don't treat properly, this recurrent ear discharge causes the perforation of the eardrum and hearing loss to the children. Sometimes it may lead to unsafe CSOM, that is infection of the bone. Rarely complications also. Mastoid abscess, brain abscess, meningitis, all these complications will happen. If you see the children, the common predisposing factor to the ear discharge is the adenoid hypertrophy and recurrent cold. Nowadays, adenoid hypertrophy is very common because of the more pollution in atmosphere and more viral infection in the society. These viral infections and pollutants cause the persistent hypertrophy of the adenoid tissue, which cause the inflammation in the eustachian tube, which leads to the otitis media. If the child has ear discharge along with the adenoid hypertrophy, if you remove the adenoid, most of the times children otitis media will get cured. Nowadays, observation for a long time is not good because pollution and viral infections will not reduce the problem of the adenoid. Persistent adenoid problem causes the breathing issues, health issues, hearing issues to the children. No worry, because many people they think adenoid removal may reduce the children immunity or may have other side effects. Usually adenoidectomy has no side effects, no problem. Problematic children with adenoid always better to remove that adenoid. In middle age, if you come, the commonest reason is the perforation of the eardrum and unsafe CSOM, that is cholesteatoma of the ear. These two cause the ear discharge, ear pain and hearing loss. If you diagnose eardrum perforation, it is very easy to treat. We can repair the drum. Most of the time success rate is 99%. Even in 1% there is a recurrence, we can do revision surgery, very simple. We can improve the hearing and we can close the eardrum perforation. If cholesteatoma, neglect it, get the surgery for cholesteatoma, otherwise it lead to the brain complications like meningitis, abscess, sometimes facial nerve paralysis also. Especially in diabetes and old age people, ear discharge don't neglect. In diabetes, the ear discharge is commonly due to the Pseudomonas infection, which is very bad infections to the ear in diabetic patients. Olden days, that they call it as a malignant otitis externa, that Pseudomonas infection almost equivalent to malignancy in olden days. Nowadays, because of good antibiotics, we are curing the disease. If there is a bone infection, we remove the infected bone along with the antibiotics. But don't neglect in diabetes patients either ear pain or ear discharge. It causes the cranial nerve paralysis and permanent disability with skull base osteomyelitis. If you have any problem of ear discharge, hearing loss, contact Asian ENT Care Center. They will examine your ear and they will check for other predisposing factors like any sinusitis and adenoid hypertrophy. They will treat both predisposing factors and the primary cause of the ear discharge in the ear. Most of the times you can get a cure of ear discharge, and your hearing also most of the times will improve. For further updates, subscribe Suman TV channel.